So healthcare, of course, is playing a huge role in this campaign, and part of why healthcare is so important is the sort of broad objectives of both candidates are so starkly opposed. The Democrats, through the 2010 healthcare law, are focused on expanding coverage through a combination of private insurance and Medicaid, program for the poor. Whereas Republicans, through Mitt Romney, are really focused on reducing federal healthcare spending. Not so much concerned about the impact on how many Americans have coverage, rather just on costs. And the result is you've got a very, as I said, stark difference, which provides voters, I think, a very clear choice. Medicaid is, I think, the best encapsulation of how these two men see healthcare. Under the Obama law from 2010, Medicaid would be the primary vehicle, or one of two primary vehicles, for expanding the number of Americans with coverage. States would get additional federal money to raise the eligibility level for what are now people who are in the near poor, people who make just above the federal poverty line. So a huge increase in those covered by that program. Conversely, Mitt Romney would change the program in a way that would have the effect of shrinking spending by what we found to be $1.26 trillion from 2014 through 2022 by letting states have more say over how they spend their money, but in turn, giving them less money to spend. So actually starkly opposing directions for the same program. The effect of these two plans on the healthcare industry is a great question, and again, a really clear one, I think, because although hospitals and drug makers and doctors groups have generally stayed out of this, they're not making a lot of noise in this campaign, almost all provider types, healthcare provider types, would lose funding if Mitt Romney became president and followed through on his plans. More interesting, I think, is what happens for insurers. Certainly with Democrats, you get many more people who newly have insurance through private insurers. The question is, does that outweigh the cost of new regulations imposed on insurers by the federal government? Some insurers say that the regulations are so onerous, so burdensome, that even though they have new consumers, it's not worth it. It's unclear to me whether that's a completely truthful argument or, to some degree, is a question of negotiating with the government, trying to get some of those regulations changed or altered in some way. But it does seem like if Republicans came in, there'd be fewer customers who had money to buy insurance and fewer regulations to curtail the way insurers would otherwise like to do business. So it's more difficult to say what the net impact would be on the insurance industry if Romney became president. But for healthcare providers, again, doctors, drug makers, hospitals for sure, definitely a negative impact in terms of revenue.